Assalamu alaikum. This is an CT abdomen, chest and abdomen for a child aged, I think it was 3 years old, complaining of progressive abdominal distension or slowly progressive, gradual abdominal distension. He made multiple trials of tapping, however the distension progressed. I don't have clear data about the results of aspirate analysis. So the patient did a CT abdomen multiphasic, which was not necessary actually. He did 4 phases. We can only do, or it is advised to do, the venous phase only. Cancel the non-contrast, arterial and delayed. It was not needed in such case. The main finding here that there is a huge, somehow cystic lesion filled with fluid, epicentered on the omentum itself. There is somehow what we can call it septi. Actually, it's not a septi. It is enhancing vessels passing through this cystic lesion. It has mass effect by compressing all the abdominal bowel loops to the center and causing what we can call a degree of compartmental syndrome, abdominal compartmental syndrome. The possibility of finding such an hugely distended abdomen with fluid, if we consider those as a septation, we can say it is chronic ascites with septations. However, what is the cause? There is no clear cause for developing an ascites in this patient. Liver looks normal, and liver function is normal. So we searched and we found an interesting possibility, which is an cystic hygroma. We usually say this diagnosis in the neck. It is we are familiar with cervical cystic hygroma, and the same pathology could occur at other regions in the body, including the omentum. And this was an omental cystic hygroma. The presence of enhancing vessel passing within this cyst is the feeding vessels for the omentum itself. The patient was operated and this diagnosis was confirmed, and they resected the whole cyst, and the patient made an 3 years follow-up by ultrasound and clinically. Till now there was no recurrence and no fluid collection inside the abdomen, normal abdominal girth and normal ultrasound abdomen, and he is on a yearly follow-up because it may recur if we lift a small component. It will refill, but gradually. So we advise the patient is now on yearly follow-up. تشخيص زي ما احنا قلنا it is large multi-compartmental cystic lesion. multi-compartmental عشان احنا شايفين ده ممكن ده compartment ده compartment ده compartment وده ماشي في النص، فاحنا عشان كده قلنا multi-compartmental. وادي عندك vessel ماشي هنا كمان، وكان بالالتراساوند باين فيها the septation. By ultrasound there was septations occupying the abdomen, mainly affecting the omentum, leading to compression of the bowel loops and according to the center. there is internal vascular enhancing septations. ممكن نقول هنا vascular shunts. فعندنا two possibilities: omental cystic hygroma versus less likely chronic septated ascites for clinical correlation. حطينا الأول omental cystic والحمد لله يعني في العملية ظهر فعلا هي omental cystic hygroma، فده من الكيسز الرير. طبعا في الشيست في شوية consolidation كانت infection يعني. فهذه مش هتشوفها كتير، it is a rare case، ولكن هبتعرضها عليكم عشان تبقوا في بالكم وتبقوا عارفين ان cystic hygroma could occur in either location in the body. أي مكان هيبقى فيه lymphatic channels ممكن يكون cystic hygroma، لأن دي واحد congenital anomalies اللي بتحصل في lymphatic system. اوكي، إلى اللقاء في حالات قادمة.